On behalf of the Princeton Club of South Florida, I'm happy to welcome you all to this discussion and really honored that we have Dr. Tina Carroll-Scott as our subject for today's discussion. I'm the club president, Pat O'Connell, and co-hosting this with me is our events chair, Lawrence Walmsley, class of Audiot, who's going to be the main interlocutor for this discussion. Tina, as she told us to call her, is as I mentioned, class of '88, originally a native of Rochester. After completing pre-med at Princeton, she got her medical degree from Boston University and did her residency at the University of Chicago and what is now Miami Children's Hospital after she came to Miami. And currently she's the director of the South Miami Children's Clinic, which I think was really the impetus, Tina, for a lot of your activities in trying to get the community vaccinated. So I thought the way we would run this is that we'll ask Tina to make some comments. Lawrence has a set of questions he's going to explore with her. I would ask you all to, I may put you on mute, but to just use the chat function at the bottom of the screen to relay questions in, and I'll either break in and ask the questions, or when we get to the end of this, we can explore those questions from listeners at greater depth. So, Tina, it's all yours.
Okay, good evening, everyone, and thank you so much for having me. And I guess I wanted to start off initially by just kind of giving a little bit of background on what I saw happening across our state with the initial vaccine rollout and why I got concerned, especially for communities of color where I work. I work in an area that's primarily African American and Hispanic. And so I became really concerned with the initial vaccine rollout across our state because they weren't happening in communities of color that were being disproportionately affected by this virus when it came to hospitalizations and death. And if you looked at the initial rollout across our state, they were really happening in the wealthiest zip codes. And so I felt like there was a huge issue, not only with access, but also with equity. And when many hospitals like Jackson and even Baptist were scheduling appointments online to get vaccinated, that left out so many people in these communities without computer access, or even the manpower to have multiple people on different computers at once, which was happening in my neighborhood in Coral Gables, trying to secure an appointment. And frankly, most people didn't even have time to navigate these sites with the slots filling up literally within minutes most days. And so I think this disenfranchised many people in these communities who essentially just gave up because it was not a priority for them. And even in communities where they did bring the access as far as providing the vaccines with pop-ups, there were additional barriers preventing the very people who were being disproportionately affected from actually getting vaccinated. And I'll talk about one of these communities, which was Overtown. And they actually had a permanent pop-up vaccine site in Overtown. And I would send people from my clinic, parents and grandparents, to Overtown to get vaccinated. And I would hear back from the families who were primarily Black that there were very few people of color in line. And the ones who were there, that they were being turned away without being vaccinated. And this was occurring because at the beginning of the pandemic, with the initial rollout, you had to be 65 years or older to get vaccinated, unless you had a medical note stating that you had an underlying health issue making you vulnerable to severe disease if you got infected. And we know that, especially in communities of color, that a lot of these residents have comorbidities like high blood pressure, diabetes, or obesity that would put them at higher risk for severe disease. But they often don't have access to a medical home where they could easily get this type of medical necessity note. And so I became really frustrated with all of this and frankly angry with the entire rollout. And I decided that I needed to be the change that I wanted to see. So I emailed our mayor, Daniela Levine-Cava, and I asked her to make my clinic a pop-up vaccine site so that I could address all of the barriers that were being created. And she graciously agreed to my request. So before actually setting a date to have the pop-up event, I needed to be clear in my own mind and, that I fully understood all of the issues at hand to make sure that the pop-up was actually successful. So I already knew that access and equity were issues, but they weren't the only issues, because there was definitely vaccine hesitancy as well in these communities. And I would say, especially in the Black community, with a very long history of medical experimentation and exploitation. And, we've all heard of the Tuskegee syphilis study, which has been cited time and time again, but there are numerous other examples throughout history of these types of experimentation and exploitation. And then there were also, the issue with the current health disparities that exist in our healthcare system today. And then couple that with the racial unrest that was occurring. And it was just a perfect storm for mistrust or distrust, whatever you want to call it, when it came to these vaccines. And then the very name of the whole project, Operation Warp Speed, invoked additional fear. And so people were convinced that things were being rushed, and they didn't want to be the quote, proverbial guinea pig. And so, I think the education piece of it was missing from the onset. And that really should have been done months before the actual rollout, especially in communities of color being hardest hit. And that was not done. So trying to educate during the actual rollout was really a Herculean task that set us back considerably when it came to gaining acceptance in these communities. So the first thing that I did before having my pop-up was to reach out to the Black churches in the neighborhood where I work, and there's literally one on every corner, to speak with the pastors who were considered trusted messengers like myself, to see what their views were on the vaccines. And it was really an eye-opener for me, because I realized that many of the pastors had not been vaccinated themselves, even if they were eligible. And they weren't really credible sources when it came to educating their parishioners. Many were actually disseminating a lot of misinformation. And so I had to educate them first and get them on board with not only getting vaccinated so that they could walk the walk, so to speak, but to be role models for church members. So after I did that, the next thing I did was that I actually sent out a survey to residents in the community to see what their views were as far as the virus and the vaccines. And what I found is that it wasn't necessarily that people didn't want to get vaccinated. It was that they felt like they didn't have enough information to make an informed decision as far as whether or not the vaccines were actually safe. And so after getting those results, I held a series of Zoom talks with the various churches in the area to basically educate people about the virus, how we got the vaccines, the fact that they weren't rushed, that we just had a ton of money that was thrown into this. And so we were able to speed up the steps. And I allowed people to ask questions and dispel any misinformation that was being spread on social media. And let me just add that, social media really has been a blessing and a curse when it comes to this pandemic. And, and I think it's really hurt communities of color the most, unfortunately. So the first vaccine pop-up event that I held was actually on March the 20th, after I'd done all of these things. And, one of the things that I had to do was to think outside the box when it came to these medical necessity forms that at that point in time were required if you didn't meet the age requirement, and especially in people that didn't have a medical home. And so for many of these people, it was next to impossible for them to get this note when they hadn't seen a doctor in years, but they were high risk. So I decided that I wanted to do health assessments on site to basically get around that barrier that was being created across the state. And so I reached out to Dr. Cheryl Holder to help me with this. And I told her that what I wanted to do with this particular pop-up was to include more people of color and not exclude them. And so I wanted to recruit a bunch of physicians who could do these health assessments on site, sign off on the medical forms so that we could vaccinate more people. And part of my vision was not only having doctors on site, but having physicians of color, and specifically Black male physicians who tend to be underrepresented in medicine in general. And I thought that that was really important, especially with the community that I wanted to target, because representation absolutely matters when it comes to getting buy-in for something like this. So in the lead up to the event, I hit every community of color in the area to spread the word, Coconut Grove, Goulds, Perrine, Richmond Heights, etc. And I went on urban radio to spread the word about the pop-up event. The other thing I did was to put my personal cell phone number on the flyers. And I also did that when I did my radio spots as well. And so I fielded every single phone call that came through. And I was able to screen people over the phone and qualify them to get vaccinated if they didn't have a medical home and didn't meet the age requirement. And that personal touch when registering people and then following up the day before the actual event to make sure that people would actually show up made all the difference. And I also had a team of friends and coworkers who worked tirelessly to help me realize this vision. I hired a DJ to play old school R&B to help relax people and to get them in a good mood because I wanted this to be a celebration and for people, to not only, realize that they were protecting themselves, but their families and the community at large. And so I had a portable microphone and I greeted every single person that attended the event. And I walked the line answering questions and, basically allaying any lingering fears that people had. And people were actually so excited to meet the face behind the phone calls. And that too helped to build trust. And then once people got vaccinated and were sitting in, the observation period for the 15 minutes, I recruited a bunch of FIU medical students and residents to educate people on what a normal immune response was after getting vaccinated. And we also had printouts of QR codes on the wall for everyone to basically scan with their smartphones to download the vSafe app, the Vaccine Safe app. And we explained how these health check-ins provided critical information to the CDC so that they would know whether any adverse side effects were occurring in some vaccinated people outside of what was witnessed in the study trial participants. And, and I really tried to explain to people that especially in communities of color with, Black and brown people, although in the study trials, we had enough participation to say, with people of color to say that the vaccines were safe, it was not at the level that it was with other races. And so, for me personally, it was important for me to make sure that on the back end of it, that once people got vaccinated, that we weren't seeing any unusual trends in these communities with people who were being vaccinated. And then after we did all of that and they left the observation area, I told every single person as they left that they were now charged with being ambassadors in the community and to spread the word to family, friends, coworkers to get vaccinated because their vaccine was only as good as the people around them. And so, the more highly vaccinated our community was, the sooner that we could get back to some type of normal. So my target was actually 500 vaccines. That's what the county gave me. And we actually went over our goal and we ended up vaccinating 648 people at that event, which was a huge success. And at the follow-up event, which was 21 days later with the Pfizer vaccine, we only lost about 20 to 30 people, which is really unheard of when you're talking about second dose events. And all of the people who didn't show up out of the 20 to 30 people called me to tell me that they weren't coming either because they had to work, they had transportation issues, or were sick. And so I think establishing that personal connection from the very beginning really made the difference. And then after that event, I actually held two more events when Pfizer received the emergency use authorization for the 12 to 15-year-olds. And one of the things I did at that event, because I knew that it's one thing for a parent to vaccinate themselves, but when it came to children, I was definitely seeing more hesitation when it came to that, even with my own clinic families. And I have three daughters. I have a 24-year-old, now 24-year-old. I had a 17-year-old at that time and a 15-year-old. And what I did was that I put my 15-year-old first in line to get vaccinated at that event. And I knew that, that by me doing that and, basically showing parents that I fully supported and believed in the vaccine safety and efficacy by putting my own daughter first. And it provided comfort for so many parents who had actually signed their kids up to come to the event, but were having second thoughts, even standing in line. And so, that really helped to calm people down and to make them feel better about vaccinating their own children. And that event also was, well attended, as well as the second dose event for the 12 to 15-year-olds. And then as the age limit dropped, the vaccine hesitancy increased. And so because of that, I chose not to do a pop-up event in the 5 to 11-year-old age group for that reason. And instead, I decided that really what was going to move the needle at this point in the pandemic was more of an organic grassroots movement where I was basically talking to patients one-on-one and answering any questions or concerns that they had about the vaccine in that age group. And, and I think that really made the difference. And let me just say this, and I think also where we are in the pandemic, almost 2 years later, I do not think that broad public health messaging is going to move the needle much. I think it's going to take, as I said before, this grassroots effort where we're getting everyday ordinary citizens who have been fully vaccinated and even boosted, talking to neighbors, friends, coworkers, and basically talking about their experience and maybe even, explaining what their reservations might have been and what got them over that threshold to vaccine acceptance, and essentially holding their hand. And I think that's probably what's going to work at this point.
Great, can you hear me? Sorry, I'm on. Great. Hi, thank you, Tina. If anyone has any questions, obviously you can type them in, and Pat will read it out. Otherwise, I can go through my list of questions. I guess let me start, Tina. That sounds amazing and also very scary to organize an event like that. Just wondering if you had done things previously in your life that prepared you for that, like that level of organizing across such a big geographic area, so many different types of people.
Yeah, so I mean, my entire career has been working in underserved communities. That's my passion, and I am more the, I guess, like the community organizer type. I'm like the boots on the ground, right? So I think my gift, my forte is really being able to connect with people. As you can tell, I love to talk, and I think having that connection, that personal touch, empathy, it builds trust, and developing those relationships, I think is really critical, especially when it comes to getting buy-in for something like this. When we're in the middle of a pandemic where people of color are being disproportionately affected. So I'm a multitasker, all of that. So I had the skills for sure to do something like this. Yeah.
I was surprised to hear that you've been in touch with the mayor, Daniela, I guess, who had just come into office probably around that time. Do you think that helped, having her? I'm guessing her politics align with yours. Was that helpful to get the government?
100%. And I need to give a shout out to Dr. Harry Aldridge. Okay, that's part of our club, because he was really instrumental. I was hesitant actually about just cold calling her. I did not know her. And I had been talking to Harry literally every day. I mean, just venting to him about what was going on across our state. And he finally told me, he's like, Tina, I know her husband, and I'm just gonna bat for you. And so he called the husband, and then one thing led to another, and then I sent the email, and she was like, absolutely. So she was incredibly responsive. What I love about her is that she's willing to literally do anything to help the underserved, or people that are not getting their fair share, so to speak. So she basically gave me free reign to do whatever I wanted.
Well, thank you, Harry, for that introduction.
Yeah.
And so, how are things today? I mean, are Black and Brown communities still at a lower vaccination rate than the general Miami-Dade population, or has that gap closed over time?
All right, so I would say that the disparities have definitely decreased since the onset of this pandemic. And I think that access is probably much less of an issue than it was before. I think the bigger issue now is really the fear and mistrust that people have. And with the onslaught of misinformation that's on social media. And as I said before, I think not educating these communities properly before the vaccines were rolled out, it hurt efforts to vaccinate these residents. And right now we're trying to play catch up, and it's difficult. I'm not going to say it's impossible, but it's incredibly difficult to educate people during the rollout, and when there's an urgency really to getting people vaccinated as quickly as possible. So, people don't really have the luxury, we don't have the luxury of giving people time to kind of process everything, because there is this urgency when we're in the middle of a global, pandemic. And, this is something where, especially in communities of color, that you can't force on people, people who have a long history of mistrust when it comes to not only our healthcare system, but even the government. So I think that's probably the biggest issue that we're dealing with right now. But yes, as far as access, now, with the vaccines being available at every retail pharmacy, for the kids, it's available at most schools, county vaccine sites, 24/7. So yes, I think the access issue definitely has improved.
Tina, we had a question about the approach to infant to 5-year-olds, the babies, basically. Does it call for a different approach in convincing their parents that little kids need to get the vaccine too?
Yes, it does. So as I stated before, much less acceptance with the 5 to 11-year-old group, and the vaccine hasn't been officially approved for the under 5-year-old group, but I'm also anticipating an even lower level of acceptance. And so I think that's where the one-on-one conversations come in, which is what I'm doing as a pediatrician with my patient families. And what I'm telling my parents is that that I absolutely believe that all children should be vaccinated and boosted if eligible, including those under the age of 5 when the authorization takes place. And I think that there's been a false narrative going around that children are not seriously affected by this virus. And although it is true that for the most part, kids have fared well when it comes to not getting severely ill and dying, but they've not been completely immune to the devastating effects of this virus. And during the Delta wave and with Omicron as well, we saw roughly about 30% of children in the 5 to 11-year-old age group who were hospitalized and who had no underlying health issues. And the vast majority of these kids were unvaccinated, but eligible. And then we had another subset of kids who were not eligible to be vaccinated yet. So it's not only, children with underlying health issues like asthma or obesity who are getting hospitalized, although those conditions do put children at higher risk. And, I cringe, every time I hear someone say that it's only kids with underlying health issues who are getting sick. And, for me personally, as a pediatrician, as a parent, I don't think it should matter. if a child has an underlying health issue or not, and is getting severely ill or dying at a higher rate. Really, I think that the death of any child should be unacceptable to all of us, and especially when we have something, i.e., a vaccine to prevent that. I think the other thing that we don't talk about enough is this MIS-C, which stands for multi-system inflammatory syndrome in children. And it's a syndrome that occurs in a child who may have been completely asymptomatic and not even known that they were infected with COVID. And then 3 to 4 weeks later, develop fever, severe abdominal pain, vomiting, extreme fatigue, and ends up hospitalized with inflammation of multiple organs, requiring ICU level care with fluids and other medications to stabilize them. And then there's the issue also, which we don't talk about enough, of long COVID. So, we talk about it more in adults, but we are starting to see kids that are suffering from this as well. And that data is starting to come out. And I can tell you that in my practice, I have kids who were completely healthy and, even athletes who now have chronic fatigue, headaches, brain fog, the list goes on and on after being infected. So what I would say is that, there's a lot that we know about this virus that we've learned since the onset of this pandemic, as far as how to treat it, who it infects, that type of thing. But there's so much more that we don't know. And there's a randomness and unpredictability, to this virus, where when we think we've gotten it all figured out, it goes into something completely different that we didn't expect. And so, I think we always have to be 10 steps ahead. And I think that the biggest criticism I've had throughout this entire pandemic is that, we've been reactive instead of proactive. And, and I feel like it shouldn't take another variant emerging that is much more severe than what we've seen with Delta and Omicron regarding our children and affecting our healthy children in greater numbers for us to decide as a society that our kids should get vaccinated and that this is probably a good thing for us to do. And, and I think we also need to set our children up for success and not failure. And especially when it comes to staying in school. Our kids have lost so much, over the last year and a half, 2 years, with the loss of in-person learning, with schools not being able to socialize normally. I mean, the mental health crisis is real. And I can tell you that as a general pediatrician in my 25 plus years of practice, I have not seen this level of anxiety and depression and suicidal ideation. I mean, that's what I'm seeing day in and day out. I'm not even seeing bread and butter pediatrics anymore. And so I think we owe it to our kids, to make the school environment as safe as possible. And, I'm not going to say that the vaccines are the only thing to do that. We talk about this Swiss cheese approach. The vaccines are a key component, okay? But, it includes all of these other mitigation strategies. So the masking, masking, it's, it works. I mean, there's no other, way to say this. I mean, and it's, it's a simple thing to do. It doesn't, care about any variant, it's, and it really reduces transmission by almost 60%. Do I believe that we need an off-ramp? Yes. Okay. Am I sick of masking? Yes. Do I think the kids are sick of masking? Absolutely. But do I think that we need to take our foot completely off the gas before we have a huge subset of kids under the age of 5 who have even, who don't even have the opportunity to get vaccinated yet? And we have such a low percentage of children in the 5 to 11-year-old age group who have yet to be vaccinated. I don't think we're there yet. And so, so I think that, we need to remain vigilant. I don't think this pandemic is over. I do think we're heading in the right direction as far as our positivity rates, which I think this morning when I looked, it was like 10%. That's great. But I think until we get to a positivity rate of 5% or less, and we have, 85% of our population vaccinated or higher, I don't think that we should just be abandoning everything at this point. So I know I went off on a tangent, but yes, I absolutely think that kids need to be vaccinated. Yeah.
Harry had a good question here about why the public health messaging failed. And I think part of your answer might have been that reactive aspect as opposed to proactive. But his question was whether public health is just out of touch with modern media, and social messaging and all of the other things that have really characterized this pandemic. What do you think? Why was it such a failure to get this education out there?
Yeah, I have so many thoughts about this, but I think the biggest thing for me, and Harry and I have talked about this as well, was the initial messaging, which I think just got botched, right? So I think that the message was that you get vaccinated and that's it. Basically you're protected and you're not going to get infected. You're not going to be able to transmit this virus. And it's like, a done deal. And what the messaging should have been, and it should have been articulated in this way to the general public, is that the purpose of the vaccines was to reduce the strain on the hospital system, which was being overwhelmed by preventing severe disease, hospitalization and death. So getting vaccinated did not mean that you could not get infected or even transmit the virus if you were fully vaccinated. So the hope was that if we had reached the level of, herd immunity, when we were rolling out the vaccines, if we had enough people that were getting fully vaccinated when they were first being rolled out, that might have been the case, right? Because, as far as not getting infected in the first place or even being able to transmit it, but we stalled, right? And then as time went on, we found out, immunity wanes after 6 months. And then, then we ended up with a variant like Omicron that had partial immune escape. And then we're seeing all of these breakthrough infections. And so, then we lost the trust of the public, because then you have people saying, oh, well, then what's the point in getting vaccinated in the first place? Because, I have friends and, family members who are fully vaccinated and even boosted, and they're still getting infected, so that's kind of where we are right now. And I think if we had done a better job, with explaining to people, this is why it is necessary to get vaccinated and getting as many people vaccinated as soon as possible. Because, yes, chances are that you probably would not get infected in the first place, because you'd have that first level of defense, with the neutralizing antibodies, and you probably wouldn't be able to transmit it either if we had enough people vaccinated where you created that wall of protection and we reduced, the level of virus that was circulating. And because that didn't happen, that's why we're in this current situation. But the vaccines were never meant to prevent you from ever getting infected or being able to transmit the virus. And that's the part that got botched. So
do you think that all the things they told us to quell fear in the beginning of the pandemic sowed the seeds of the failure of the whole program, when they told us, oh, it's only old people who are going to die?
Yes.
Young children never get sick with this. This is all before the vaccine.
Yes.
And then not telling us, and then rolling out the vaccine in such a slow way to say, which only they could do, but to explain that better, why they're rolling out so slow. Because when people were being told, well, you're going to get in line last because you don't really need the vaccine, that's why we're putting you in line last. And then finally, not explain that the only way the vaccine will succeed is if you get a very high percentage of people taking it, not which we needed to be higher than 70%. And it would fail otherwise, because even if you only get 70% of people getting the measles vaccine, measles would be all over the community. So, and people don't understand that at all. When I try to explain that to people, I said, measles would be all over if you didn't have almost nearly 100% of kids getting measles vaccine. And that almost sowed the seeds of the failure of the whole project when they were doing all these things.
Yeah, 100% that. And I would add too that, again, as I stated, I think that we were woefully unprepared, and we shouldn't have been. And, and I think especially when it came to communities of color, as far as, educating them before the actual vaccine rollout, but even after the rollout, part of the reason I had the pop-up, again, is, I feel like there should have been no barriers at all when it came to communities communities of color with the initial vaccine rollout. There should have been no age requirement. Like, you know, basically in those communities, it should have been wide open, right? So, I mean, because, you know, we needed to stop the bleeding first with those communities that were being disproportionately affected. And, you know, and also realizing that in those communities, a lot of the things that we were asking people to do, like these mitigation strategies, you know, social distancing and quarantining, are next to impossible when you're talking about families that are, you know, living in multi-generational homes, and you have one infected individual, and where are you going to go? Like when you're living in public housing. And so, you know, and so really, I think that that the focus should have been, you know, making sure that those residents in those communities were fully vaccinated, you know, who met the vaccine age requirement, you know, at that time. And especially because a lot of these people work in frontline industry jobs, and, you know, that contribute to their higher risk of exposure. And so that should have been the first priority. And obviously alongside healthcare professionals, you know, working on the front line.
Pamela asked about boosters. How are you dealing with the issue of boosters with people that, you know, you came in for the first and second rounds?
I'm going to tell you that really for me, what I'm seeing, it's almost like non-existent. I mean, like where we are now, now in this pandemic, I mean, people do not want to get boosted. So it's been a trickle. And it's me really just, you know, trying to encourage people, you know, individually. I mean, you know, why this is necessary, using my own family as an example, that all three of my kids are, you know, fully vaccinated and boosted, you know, the 16-year-old, the 18-year-old, the 24-year-old, and trying to get buy-in that way. But no, it's been a hard sell for sure.
Yeah. Charlotte asked about the difficulties of transportation in lower income communities. I mean, getting someplace where you can get a vaccine has got to be an issue. Can we duplicate you, Tina? Can we put you in other places?
Yeah,
to get you closer?
That would be great. But I can tell you that our mayor really, she did a phenomenal job, and, you know, and she listened to a lot of the recommendations that I and, you know, a lot of other people working in these communities, you know, told her. And one of the things she did is that, you know, we recommended bringing the vaccines to, you know, restaurants, hotels, you know, where people work, so that they wouldn't have to take off time, you know, to do any of this. And she did that, you know. So as I said before, I mean, I think that probably the access is much less of an issue than it was, you know, last year. So
yeah. Good. I'm looking here at the other questions that have come in. There was a question when you did your first survey. How did you, after you had talked with ministers, how did you actually identify the people that you needed to survey in order to find out what attitudes were toward the virus and the vaccine?
Okay, so yeah, and I'll read you some of the questions. So a lot of them were my patients, and then I also sent the survey to the various churches, and they sent it out to their parishioners, and then, you know, some of the community organizations. And so I'll just kind of briefly go over some of the questions. So I asked, you know, have you been tested for the virus that causes COVID in the last year? Have you or any of your family members or friends been hospitalized or died from COVID in the last year? Do you think COVID is more serious than the flu? Do you take the flu vaccine when it's offered every year? Do you believe vaccines are necessary to prevent deadly diseases? Will you take the COVID-19 vaccine when it's available to you? And if you answered no or maybe to the above question, please list all of your reasons below. And for example, you know, do you think it was rushed and therefore not safe? Do you not trust it? You know, and so on and so forth. Then I asked, you know, if you're hesitant about taking the vaccine, you know, who in your community would you trust to provide accurate information, and you can select more than one person. And I was actually scared about the responses, to this, because the responses were, your physician, pastor, or faith leader, community leader, hairdresser, barber, teacher, family, friends. And I was scared to see where a physician would actually land on this list. And I was so hopeful, when I saw that physician actually came in first, and then it was pastor or faith leader, and then the hairdresser or barber came in third. And so when I saw that, I realized, well, people still do trust their doctors, and so I kind of used that response, to figure out how to do the pop up. But no, I mean, most of the people who responded, it wasn't that they were against it. It was just that they felt like they were being informed,
I know you mentioned you have family in Jamaica. Can you contrast what your experience in South Florida has been with what's going on in the Caribbean?
Yeah, so what's happening in Jamaica is, it's multi-pronged. So initially, what happened was that they did not have access to any vaccines. And then when they finally did get vaccines, they were getting vaccines from not only the US, but from the UK. So they had AstraZeneca and J&J, and those were the only two options initially. And so there was a lot of pushback because the Jamaican population felt like that they were basically getting the, I guess, throwaway or leftover vaccines that the Americans did not want. And so they refused to take it because of that. And then when, they had more choices, when, they started getting some shipment of Pfizer, it was in a really small supply. And so the Jamaican government actually saved those vaccines for the school age children, who were eligible. And I think that the choices or lack of choices, and then just how long it took to even get vaccines there, people just started, at that point, just digging their heels in and just saying, I don't want this, for a vast, array of reasons. And then I think also religion plays a very big part. I would say that a large percentage of the religious leaders on the island have not bought into this vaccine and think that you can basically pray, COVID away, and that's who people are listening to. So there's that aspect of it, and just a whole host of other I guess conspiracy theories that that people are feeding into on social media. You have a lot of Jamaican males who don't want to take it because they believe that it will affect virility. You have females, believing about fertility issues, and so they don't want to take it because of that. The list goes on. And I think also with Caribbean culture, they're very much into taking herbs and garlic, and I mean like a more holistic approach. If you just eat well enough and take your vitamins and that sort of thing, that you're not going to get infected. And so that's kind of what the mentality is. And and I guess what I would also say too is that even here in the US, we have to be careful about thinking that there's a one size fits all strategy to Black and brown communities, because there isn't. So what African Americans might fear and and the hesitancy that they have is completely different than what you may see with the Jamaican diaspora or the Haitian Americans, or even in the Hispanic community. I mean, what Cuban Americans might fear versus Mexicans. So it is very dependent on that particular area. And so I think that it's something moving forward with the next pandemic, which I'm sure will happen, that we identify people in those communities that that we can educate properly, and those will be like the go-to people when we have the next crisis, that can hit the ground running, that understand the neighborhood, the community, and can be a credible source of of information. So it doesn't necessarily have to be, the physician, trusted messengers, or even the pastors. I mean, it can be, everyday ordinary citizens who got vaccinated, who believe the science, and live in those communities, who can talk to their neighbors and family members and that sort of thing. So I think we need to be creative when we look at kind of creating the infrastructure that we need in those communities. And the other thing I would say too is that since we already know that Black and Brown communities have been disproportionately affected because of the comorbidities that I discussed, whether it's the diabetes or hypertension or obesity, that we also need to start focusing on increasing the overall health of these communities as well. So even if they decide not to get vaccinated, right? We know that with this particular virus, if your BMI was over, 39, that, I mean, your chances of survival were pretty slim, right? So, addressing food deserts in a lot of these communities that don't even have access to healthy foods. So, the best they have is a convenience store or bodega, right? With, prepackaged foods, high in salt and all of that, right? So, so we need to provide healthier options. The other thing is, green space. I mean, making sure that these people have a place to exercise and to, keep themselves healthy. The kids have a place to ride their bikes safely, and that type of thing. And then a medical home, we need to make sure that, that people have access to healthcare, right? And so, that if they have diabetes or hypertension, that that it's being managed properly, so that when the next virus comes, that they're hopefully in a better situation health wise, so that they don't get devastated to the level that we saw with COVID. So I think that those are things that we can work on as well.
You're probably in touch with a lot of your colleagues across the country who are dealing with similar communities to those that you're addressing. Is it your sense that we've done better in South Florida than other parts of the country have? I'm always surprised when I hear the vaccination rates in Miami-Dade, which seem, in the 90s. I mean, they really seem high compared to what you hear in other parts of the country.
Yeah, I think that's true. And I think, there's definitely a regional factor as well. And I mean, we see that across the U.S., with the South, versus, I mean, some of the, the West Coast states, or, around the East Coast. So I do think that that's true. And so, yeah, but I mean, I think that in general, that across the board, it's been a hard sell with, specifically with Black communities. Yeah.
But what about our death rate?
Just because of the history.
What about our death rates here, Tina? Have you looked at that at all? I just wonder about our death rates, because we've moved up quite a bit in the death rate group now. And if you look
don't have those numbers, so I apologize for
when
that.
you look at it since July of 2020, if you take out the first couple of months when the northeastern states were flat-footed, I don't know if we performed any better than any. I think we're performing poorly, actually, if you look at the death rates, because we have a very high death rate number per 100,000 versus the states since that July date. And our vaccine rate statewide, maybe in South Florida, is a little higher, but we're also buoyed by, I've been struck by the number of patients who tell me their relatives came from Guatemala, their relatives came from Dominican Republic to get vaccinated here, who may be counted as Dade County vaccines when they don't even live here, because we've had such a good number of tourist vaccines, which I'm not against, but I think they may have been counted as that. So I wonder if our vaccine rate is a little spuriously high. And the death rate in Florida, actually, I saw some data from somewhere where our death rate has been higher than other southern states and other northeastern states since July of 2020.
Well, and add to that, how credible is the rest of the data on the case rate, on the infection rate also? How many people are not reporting, or now that we have such a prevalence of home testing, those cases are not getting reported. So is there really, credibility with the data that we're working with? And I know early on, there were all kinds of controversies relating to how the state was collecting and reporting its data also.
And asking one other question, getting back to that challenge you talked about, how do we help increase the health level of these communities? How do you get money to do that? Because it costs a lot of money, and it seems like
Yes, it does.
It seems like when this has been talked about before, it's like it even starts with doctors saying, well, they're almost these people who are heavy or having these problems of other problems. It's almost like self-deserves that they have bad health because they're not paying attention.
Right.
It's their fault.
Right.
It's their fault. So why should we pay money for that? And how do you get the society in general to realize investing in that sort of healthcare is going to save money for everyone? Because then they're not going to have long-term illnesses. You're not going to be treating it. But that still seems to be a battle that's been now for 30 years been talked about, but not much has been done. Because there's not been a big investment.
I 100% agree with that. And I think the other point I wanted to make is that, we also need, we need to increase the rapid home, testing kits in these neighborhoods. I mean, yes, it's great what our federal government has done with the 4 tests, but if you have 10 people living in your house, I'm not sure how beneficial that's going to be. And I would say that besides the hesitation with getting vaccinated, there's also hesitation with getting tested. And, a lot of people don't want to go to these county sites and find out that they're positive and feel like, I guess, the government, knows what's going on with their, with their positive test and, and feeling, I guess, forced in some way to stay home and quarantine when, they have to put food on the table and pay their bills and that sort of thing. So I think, maybe in some ways empowering people so that they have some anonymity and, giving them the rapid tests and explaining how to use them, why this is necessary to know your status and hoping that they do the right thing, and especially if they live in homes where they have vulnerable individuals, elderly or, whatever underlying health issues they may have, but at least, giving them the ability to make those decisions. And I think that would be helpful as well. And why we're not at that point, like, for example, my oldest daughter who's in the UK and, she has easy access to lateral flow tests, she can just order them and they come in like a day or two. But, I think we should have been there a long time ago. Why we're not there, I cannot tell you. and especially focusing on, on those communities being hardest hit. So, there should have been a surplus of rapid tests for those communities.
The last question, and then we'll ask you for your closing remarks. There was Pamela asked whether you have confidence that we have learned enough from this experience that the next round will actually be able to respond better. And my wife said she remembered when she was a kid in elementary school that there was a lot of healthcare education, vaccines, polio vaccines, delivered through the educational system. Are any of those answers that you think will put us in better stead next time? No.
Listen, I'm going to tell you, I have just been so disappointed in, I guess, humanity. Really, throughout this entire pandemic. And I think that I never thought that I would see the day where something like this, a global pandemic would, become so polarized. When it comes to, protecting your fellow man. I don't even understand that whole mentality. And, and what I tell, people all the time is that, this is the one thing with this pandemic where it's not enough for you just to care about yourself. Okay. Because, we can't vaccinate certain groups of people and not others and expect to get out of this, without a tremendous loss of death, additional loss of death. And I feel like, we've gotten to a point where the numbers don't matter anymore to many people. Like they've become numb to these statistics, right? So, if you tell people, we've had, 750,000 people who have died already. Honestly, that's where we are, right? So I don't even use those statistics anymore. It's more just, okay, you know what? this is, do you want to continue this type of life, right? I mean, with our kids, suffering from mental illness, not having any type of normalcy, what we're going through, everyone has COVID fatigue. Like there's a way to do this, right? But it takes everyone having skin in the game, right? It can't just be certain people, getting vaccinated and not others, right? We all have to, it has to be a collective effort. And so I'm not saying that the message is getting across. I'm trying my best, but it is a hard sell, and it's so incredibly disappointing. And I don't have a lot of confidence, honestly, with what's going to happen, with the next pandemic. I don't think we've learned much. Put it that way. Yeah.
Well, the one thing that I will say is, the shining part of this is people like you who have really made a difference. And I'm just really in awe. And I think, I know that you were named Tiger of the Week by PAW, but I think you really deserve even more credit than that. This is really the essence of Princeton in the nation's service. So I'm glad you came with us, and I'm really proud of what you've been able to do in South Florida. Any other questions or comments that people would like to make? Tina, thank you for joining us. This is really great.
And I want to give another shout out to Harry, because I mean, he really, really, really has been a tremendous support for me throughout this entire pandemic, and has helped to realize my entire vision. So I cannot thank him enough.
It was Tina's energy. Well. It was Tina's energy to do it, and I was glad what little I could do to make help make that happen for you, because it was your energy that made that happen, and the personal time you took with all those people, that I think you probably saved hundreds of lives that they don't even realize it, by making that happen. And people that may not even been at the vaccine, but someone else stopped the chain of disease that happened that would have reached them. So that was a wonderful thing that you did.
Thank you.
It was really great. All right. Thank you all.